In the heart of Central Park, two little black twin boys were selling toy cars to save their mother's life. When billionaire tech CEO Ethan Caldwell stopped to buy a toy car from them, he had no idea it would lead to the most important decision of his life. Before we dive into the main story, if you believe everyone should be treated equally and respectfully, no matter their skin color, then hit the subscribe button. Let us know where you're watching from. If you've already subscribed to our channel, thank you so much. May God bless you and your family. So now, without wasting any time, let's get into the main story. The October wind carried the scent of fallen leaves through Central Park as Ethan Caldwell checked his platinum watch. 2 o'clock. He had 30 minutes before the most important meeting of his career. $50 million hung in the balance, enough to expand his technology empire across 3 continents. But something made him slow his hurried pace along the winding path. 2 small voices, barely audible above the rustling trees. "Please, mister. It's a really good car. My mom made it herself. See how the wheels turn?" Ethan turned toward the voices and saw them. 2 identical boys, no more than 8 years old, sitting on a park bench with a small wooden toy car between them. Their clothes were clean but worn, their sneakers scuffed from use. One boy held the car up hopefully while the other counted crumpled dollar bills. "How much?" Ethan found himself asking, though he couldn't explain why he'd stopped. The boy with the car looked up with bright, hopeful eyes. "We're asking $20, but we'll take 15, or 10, or whatever you think is fair." "It's hand-carved," the other boy added quickly. "Our mom made it when she had time. She used to make lots of things before." "Before what?" Ethan knelt down to their level, his expensive suit forgotten. The boys exchanged a look. The one holding the car spoke carefully. "Before she got sick. I'm Liam, and this is my brother Noah. We're twins." "I can see that." Ethan smiled gently. "What's wrong with your mom?" Noah's voice dropped to almost a whisper. "She has diabetes, the bad kind. She needs medicine every day or she could die. But it costs $300 for 1 month, and we don't have insurance anymore." "She lost her job 3 weeks ago," Liam continued. "She was a nurse at St. Luke's Hospital. She said she was fired for doing the right thing. But I don't understand what that means." Ethan felt something shift inside his chest. He'd grown up poor himself before building his fortune. He remembered being hungry, remembered his own mother choosing between medicine and food. But he'd buried those memories under years of success and boardroom battles. "How much have you made today?" he asked. $12, Noah said, holding up the bills. "But we need to sell at least 15 more cars to get enough for Mom's medicine. We only have this one left." "And where are the other cars?" The boys looked at each other again. Liam's eyes filled with tears he tried to blink away. "Nobody wanted them. We've been here since morning. Most people just walk by. Some people said mean things." Ethan's phone buzzed. A text from his assistant. "Investors arriving early. Need you here ASAP." He looked at the phone, then at the boys, then at the carefully carved wooden car in Liam's small hands. The toy was beautiful, detailed, painted in bright blue and red. Someone had spent hours creating it with love. "I'll give you $500 for that car," Ethan said. Both boys stared at him with wide eyes. "500?" Noah whispered. "Mister, that's more than we need for Mom's medicine this month." "And next month too," Liam added, hardly believing it. Ethan pulled out his wallet and counted out $500 bills. "What's your last name, boys?" "Carter," they said together. "Liam and Noah Carter." He handed them the money. "This is for your mom's medicine, and I want you to keep the car too." "But sir," Noah protested, "if you're paying for it, you should have it. I want you to give it to your mom from me. Tell her that someone believes she did the right thing, even if she lost her job for it." The boys' faces lit up with joy and relief. They threw their arms around Ethan, nearly knocking him over. "Thank you, thank you, thank you," they chorused. Ethan's phone rang. He glanced at it and saw his assistant's name. The meeting. The $50 million. The expansion that would make him one of the richest men in America. He declined the call. "Boys, I need to ask you something important. What hospital did your mom work at? And do you know why she was really fired?" Liam wiped his eyes with his sleeve. "St. Luke's Hospital on the Upper East Side." Mom said she reported a doctor for being mean to black patients. She said the doctor was giving them different treatment, not believing when they said they were in pain. Dr. Kessler, Noah added. Mom had recordings on her phone. She said she tried to do things the right way, but nobody listened until she went to the newspaper. And then they fired her the next day, Liam finished. They said she was a troublemaker. Ethan felt a cold anger building in his chest. What's your mom's full name? Angela Carter. She's the best nurse in the world, Noah said proudly. Where is she now? At home. She's been applying for jobs, but nobody will hire her. They all call St. Luke's for references, and they say bad things about her. Ethan's phone rang again. This time he answered. Ethan, where are you? His assistant's voice was frantic. The investors are here. They're asking questions about the delay. Cancel the meeting, Ethan said calmly. Cancel it? Ethan, this is $50 million. This is your future. My future just changed. Cancel it and tell them we'll reschedule. Then I need you to do something for me. Contact our legal team. I want everything they can find on St. Luke's Hospital. Financial records, personnel files, anything public record. And get me a meeting with our acquisition team. You want to buy a hospital? Maybe. I'll call you back in an hour. He hung up and looked at the boys, who were staring at him with confusion and awe. Boys, I want to meet your mom. Do you think she would talk to me? You want to meet Mom? Liam asked. Why? Because I think I might be able to help her, and maybe she can help me understand what really happened at that hospital. The boys looked at each other, having one of those wordless twin conversations. Finally, Noah nodded. She's at home. It's not far from here. But Mr. What's your name? Ethan. Ethan Caldwell. Mr. Ethan, why are you helping us? You don't even know us. Ethan thought about that question as they walked through the park. Why was he helping them? He'd passed hundreds of people in need over the years. He'd donated to charities, wrote checks to foundations, but he'd never stopped to get involved personally. Sometimes, he said finally, you meet someone at exactly the moment when you both need each other. I think that's what happened today. The Carter family lived in a small apartment in a pre-war building 20 blocks from Central Park. As they climbed the 3 flights of stairs, Ethan could hear the sounds of families living their lives. Children playing, adults talking, the everyday symphony of people making do with what they had. Mom! Noah called as they reached the door. Mom, we sold the car, and we brought someone to meet you. The door opened, and Ethan found himself face to face with Angela Carter. She was a woman in her early 30s with kind eyes that looked tired and worried. She wore scrubs as if she'd been getting ready for a job she no longer had. Boys, what's going on? And who is this gentleman? Mom, this is Mr. Ethan, Liam said excitedly. He bought our car for $500. We have enough for your medicine. Angela's eyes widened as she looked from her sons to Ethan. $500? Sir, I don't understand. That's far too much for a toy car. May I come in, Mrs. Carter? I'd like to talk with you about St. Luke's Hospital. Angela's expression changed immediately. Her welcoming smile faded, replaced by wariness and pain. What about St. Luke's? Are you a reporter? A lawyer? Neither. I'm someone who might be able to help. My name is Ethan Caldwell. Recognition dawned in Angela's eyes. The tech billionaire? What could you possibly want with me? To understand what really happened to you, and maybe to do something about it. Angela stepped aside to let him in. The apartment was small but immaculately clean. Family photos covered one wall, showing the boys at various ages, always smiling. A small desk in the corner was covered with job applications and rejection letters. Boys, go to your room and do your homework, Angela said gently. Mr. Caldwell and I need to talk. When they were alone, Angela gestured for Ethan to sit on the worn but comfortable couch. Would you like some coffee? It's not fancy, but it's hot. That would be nice, thank you. As Angela prepared the coffee, Ethan looked around the apartment. This was a home filled with love but strained by hardship. He could see where corners had been cut, where things were repaired instead of replaced. Yet everything was spotless and organized. Your boys told me you were fired for doing the right thing, Ethan said when Angela returned with 2 steaming mugs. Angela sat down across from him, her hands wrapped around her coffee for warmth. They said that? They're too young to understand the full situation. Help me understand it. Angela was quiet for a long moment, staring into her cup. Finally, she began to speak. I've been a nurse for 8 years. I love my job, loved my job. I believed in providing care with dignity and compassion to every patient, regardless of who they were or what they looked like. She paused, gathering her thoughts. About 6 months ago, I started noticing patterns. Black patients, especially Black women, were consistently given lower doses of pain medication. Their complaints were dismissed more quickly. When they said they were in pain, doctors would suggest they were exaggerating or seeking drugs. How often did this happen? Too often. At first, I thought maybe I was imagining it. But then I started paying closer attention, keeping notes. The disparities were clear and consistent. Black patients received substandard care. Ethan leaned forward. What did you do? I followed protocol. I spoke to the charge nurse. She told me to mind my own business. I spoke to the department head. He said I was being oversensitive. Finally, I went to Dr. Margaret Kessler, the chief medical officer. Angela's voice grew bitter. Dr. Kessler told me that pain perception varies among different populations and that the doctors were following established protocols. She said if I continued to question medical decisions, I would face disciplinary action. But you didn't stop. I couldn't stop. I became a nurse to help people, not to be complicit in discrimination. So I started documenting everything. I recorded conversations when I could do so legally. I kept detailed notes. I took photos of treatment disparities. And then, I tried one more time to work within the system. I requested a meeting with the hospital administrator. I presented my evidence. I asked for an investigation. Angela set down her coffee cup with shaking hands. Instead of investigating, they launched an investigation into me. They said I was violating patient privacy by taking notes. They said I was being disruptive to the medical team. They put me on administrative leave pending a review. That's when you went to the media? I felt I had no choice. People were suffering. Patients were receiving inadequate care because of their race. I contacted a health reporter at the Times. I showed her my documentation. She verified my claims with independent experts. Angela's voice dropped to almost a whisper. The story ran on a Sunday. By Monday morning, I was fired for violating hospital policy and bringing negative attention to St. Luke's. Ethan felt the anger building in his chest again. What happened to Dr. Kessler? Nothing. She's still there. In fact, I heard she's been promoted to Senior Vice President of Medical Affairs. And you haven't been able to find another job? Angela laughed bitterly. Who's going to hire a whistleblower? Every hospital I apply to calls St. Luke's for a reference. They all hear the same story. Angela Carter is a disruptive employee who violated patient privacy and damaged the hospital's reputation. Even though you were trying to protect patients? The truth doesn't matter when powerful people decide to destroy your reputation. Ethan was quiet for several minutes, thinking. Angela sat nervously, probably wondering why a billionaire was sitting in her living room asking about her troubles. Finally, Ethan spoke. Mrs. Carter, what would it take to fix St. Luke's? If you had unlimited resources, how would you change things? Angela looked at him strangely. That's a hypothetical question. No one person has that kind of power. Humor me, Angela thought carefully. First, you'd need new leadership. Dr. Kessler and her allies would have to go. Then you'd need comprehensive policy changes, mandatory bias training for all staff, patient advocates in every department, regular audits of treatment disparities, transparent reporting of patient outcomes by demographics. What else? Cultural change. That's the hardest part. You can change policies, but changing hearts and minds takes time. You need staff who are committed to equity, not just following rules to avoid lawsuits. And you think all of that is possible? With the right leadership and enough resources? Yes. But it would take someone with serious power and influence, someone who couldn't be intimidated or bought off. Ethan pulled out his phone and made a call. Richard? It's Ethan. I need you to prepare an acquisition proposal. St. Luke's Hospital. Yes, the whole hospital. I want it fast-tracked. Money is no object. Angela stared at him in shock as he continued the conversation. Check for any outstanding debt, pending lawsuits, anything that might make them vulnerable to a takeover. And Richard? I want this kept absolutely confidential until we're ready to move. He hung up and looked at Angela, who was sitting with her mouth open. Mr. Caldwell, are you planning to buy St. Luke's Hospital? I'm going to try. It might not work. They might not be for sale. But if they are, I intend to own that hospital within the month. But why? Why would you do that? Ethan thought about Liam and Noah, sitting in the park with their last toy car, desperate to save their mother. He thought about his own childhood, his own mother's struggles. He thought about all the patients who had suffered because of Dr. Kessler's policies. Because some things are more important than money, Mrs. Carter. And because I think you're exactly the kind of person who should be running nursing services at that hospital. Me? Mr. Caldwell, I'm unemployed. I've been blacklisted. No one will hire me. I will. If I acquire St. Luke's, I want you to be the director of nursing services. You'll have full authority to implement the changes you just described. Angela stood up abruptly, pacing to the window. This is crazy. This is like something out of a movie. Billionaires don't just buy hospitals to help nurses they met an hour ago. This billionaire does. She turned to face him. Why? Really, why are you doing this? Ethan joined her at the window, looking out at the city below. 20 years ago, I was one of those kids selling things on the street to help my family survive. I built my fortune by being smart and ruthless and focused on profit above everything else. Today, your sons reminded me who I used to be. And you reminded me who I want to be. Mr. Caldwell. Ethan, even if you could buy the hospital, do you have any idea how much resistance you'd face? Dr. Kessler has allies throughout the medical community. The staff who've been implementing discriminatory policies aren't going to change overnight. Then we'll replace them. It's not that simple. You can't just fire doctors and nurses without cause, and changing a culture takes time. Ethan smiled. Mrs. Carter, I didn't build a multi-billion-dollar company by accepting that things can't be changed. Yes, it will be difficult. Yes, it will take time, but it's possible and it's necessary. Angela was quiet for a long moment, looking out at the city where she'd tried to build a career in nursing, only to have it destroyed for doing what she believed was right. If you're serious about this, I have conditions. Name them. First, this can't be about revenge. If we do this, it has to be about creating better care for patients, not about punishing people we don't like. Agreed. Second, any changes we make have to be sustainable. When you get bored with this project and move on to something else, the reforms have to stay in place. I don't get bored with things that matter. Third, I want complete authority over nursing policies and procedures. No interference from administrators or board members who think they know better than the people actually providing patient care. Done. Angela turned to face him fully. You're really serious about this. I've never been more serious about anything in my life. The boys' voices could be heard from their bedroom, laughing and playing. The sound reminded both adults what this was really about. Creating a world where children didn't have to sell their belongings to keep their parents alive. There's something else you should know, Angela said quietly. The recordings I made, I still have them, along with all my documentation. If you're really going to do this, you'll want to hear them. Can you play them now? Angela went to a small desk and pulled out her phone. This is from a conversation with Dr. Kessler 3 weeks before I was fired. I recorded it in the break room after she made some particularly offensive comments. She pressed play. Dr. Kessler's voice filled the room, clear and unmistakable. Angela, you need to understand that different populations have different pain tolerances. It's been scientifically established that Black patients often exaggerate their symptoms. We can't just hand out narcotics every time someone claims to be in pain. Angela's voice on the recording was professional but firm. Dr. Kessler, I've reviewed the literature you're referring to. Those studies have been thoroughly debunked. There's no scientific basis for assuming that Black patients feel pain differently or are more likely to be seeking drugs. I've been practicing medicine for 20 years, Angela. I think I know how to assess patients appropriately. But the data shows clear disparities in treatment. The data shows that we're following established protocols. If you continue to question medical decisions, I'll have no choice but to write you up for insubordination. Angela stopped the recording. I have 6 more conversations like that, plus documentation of at least 30 cases where Black patients received substandard care. Ethan felt his anger crystallizing into cold determination. We're going to need all of that evidence. And Mrs. Carter? Yes? You might want to start calling me Ethan. We're going to be working together. Over the next 2 weeks, Ethan's acquisition team worked around the clock to put together an offer for St. Luke's Hospital. They discovered that the hospital was in serious financial trouble. Medicare reimbursements were down, several major donors had withdrawn support, and they were facing 2 significant malpractice lawsuits. The hospital's board of directors was preparing to accept a merger offer from Meridian Health Systems, a large corporation known for cutting costs by reducing staff and services. The merger would likely result in hundreds of layoffs and the closure of several departments that served low-income patients. Ethan's offer was higher than Meridian's, and it came with guarantees to maintain current staffing levels and expand services to underserved communities. After a week of negotiations, the board voted to accept Ethan's acquisition proposal. The news broke on a Tuesday morning. By noon, every major media outlet was covering the story of the tech billionaire who had bought a hospital. Most assumed it was a business investment or a philanthropic gesture. None of them knew about 2 8-year-old boys selling a toy car in Central Park. Dr. Margaret Kessler requested a meeting with Ethan the day after the acquisition was announced. She arrived at his office wearing her best professional smile and carrying a folder full of her accomplishments. Mr. Caldwell, congratulations on your acquisition. I'm Dr. Margaret Kessler, Chief Medical Officer at St. Luke's. I wanted to introduce myself and discuss how we can work together to maintain the hospital's excellent reputation. Ethan gestured for her to sit down. He'd been looking forward to this conversation. Dr. Kessler, I appreciate you coming in. I've been reviewing personnel files and hospital policies. I have some concerns about patient care standards. I assure you, Mr. Caldwell, St. Luke's maintains the highest medical standards. We follow all established protocols and guidelines. Tell me about your pain management protocols, specifically how you assess patient complaints. Dr. Kessler's smile faltered slightly. Our pain management follows evidence-based guidelines. We're very careful about narcotic prescriptions, given the current opioid crisis. I see. And how do you account for the fact that Black patients at St. Luke's receive 30% lower doses of pain medication than white patients with identical conditions? I'm not sure where you're getting those statistics. Ethan slid a folder across the desk. Independent analysis of your hospital's records over the past 18 months. The data is quite clear. Dr. Kessler opened the folder, her face growing pale as she scanned the pages. These numbers are taken out of context. Patient care is complex, and there are many factors. There are also recorded conversations where you specifically state that Black patients exaggerate their pain and should receive different treatment. Dr. Kessler's professional composure cracked. How did you? Those conversations were private. They were illegally discriminatory. Dr. Kessler, your employment at St. Luke's is terminated, effective immediately. Security will escort you out of the building. You can't fire me. I have a contract. I have rights. I'll sue you for wrongful termination. You're welcome to try, but I think you'll find that discrimination and violation of patients' civil rights constitutes cause for immediate dismissal. As security escorted Dr. Kessler out, Ethan felt a grim satisfaction. But he knew that removing one person wouldn't solve the deeper problems. Real change would require rebuilding the hospital's entire culture. Angela started work as Director of Nursing Services the following Monday. Her first action was to call a meeting of all nursing staff. I know some of you may have concerns about my appointment, she said, addressing the packed conference room. You may have heard that I was fired from this hospital for being a troublemaker. That's true. I was fired for documenting discriminatory practices and advocating for equitable patient care. The room was silent, tension thick in the air. I'm not here for revenge. I'm here to build a nursing department that provides excellent care to every patient, regardless of their race, ethnicity, economic status, or any other factor. We're going to follow evidence-based protocols, not assumptions or biases. One of the senior nurses raised her hand. What about the doctors who don't want to change? Some of them have been practicing the same way for decades. Then they'll need to adapt or find somewhere else to practice. Patient care is our priority, not physician comfort. Over the next several months, Angela implemented comprehensive reforms. She instituted mandatory bias training for all staff. She created patient advocacy positions in every department. She established regular audits of treatment patterns to identify and address disparities. Some staff members embraced the changes. Others resisted or left for positions elsewhere. Gradually, the culture began to shift. Ethan visited the hospital regularly, not as an owner checking on his investment, but as someone genuinely interested in the progress being made. He often found Angela working late, reviewing patient files, or training new staff members. "You know you don't have to work 18-hour days," he told her one evening as he found her in her office at 9 o'clock. "Yes, I do," she replied without looking up from her computer. "Every day we delay implementing these changes is another day that patients receive substandard care. I can't live with that." How are Liam and Noah handling all this? Angela smiled, the first genuine smile he'd seen from her all week. They're proud of their mom. They tell everyone at school that she's fixing the hospital where she works. They don't fully understand what that means, but they know it's important. They're right. It is important. "Ethan, can I ask you something?" "Of course." "Do you ever regret it?" "Buying the hospital, I mean. You could have made $50 million that day instead of getting involved in all this mess." Ethan thought about that question, the same one he'd been asking himself for months. "Angela, I've made more money than I could spend in 10 lifetimes. But until I met your boys that day, I'd never done anything that actually mattered. Money is just numbers on a screen. This is real change in people's lives." Even when it's difficult? Even when progress feels slow? Especially then. By the end of Angela's first year as director of nursing, St. Luke's Hospital had been transformed. Patient satisfaction scores had improved dramatically. Treatment disparities had been virtually eliminated. Staff turnover had decreased, and the hospital was attracting top medical talent who wanted to work in an environment committed to equity and excellence. The changes didn't go unnoticed. Medical journals wrote articles about St. Luke's innovative approaches to addressing healthcare disparities. Other hospitals began adopting their protocols and training programs. Dr. Margaret Kessler, meanwhile, found herself unable to find another position. Word of her discriminatory practices had spread throughout the medical community. The recordings that Angela had made became evidence in a civil rights lawsuit filed by former patients. Kessler eventually left medicine entirely, her career destroyed by her own prejudice. 1 year after Ethan first met Liam and Noah Carter in Central Park, he invited them and Angela to dinner at his penthouse apartment. The boys, now 9 years old, were amazed by the view of the city from the top floor. "Mr. Ethan," Liam said as they ate dessert, "Mom says you bought the hospital because we sold you our toy car. Is that really true?" Ethan looked at Angela, who nodded encouragingly. "It's true, Liam, but not the way you might think." "What do you mean?" "I didn't buy the hospital because you sold me a car. I bought it because you and Noah showed me something I'd forgotten." "What's that?" Noah asked. "That the most important things in life aren't about making money or being successful. They're about helping people and doing what's right, even when it's hard." "Is that why Mom got her job back?" "Your mom got her job back because she's an excellent nurse who is willing to fight for her patients. I just made sure she had the opportunity to do it." As the evening went on, Ethan found himself thinking about the chain of events that had brought them all together. A chance encounter in a park, 2 boys trying to save their mother, a conversation that revealed injustice, a decision to act rather than just walk away. "Angela," he said, as the boys played with toys he'd bought them, "what's next for the hospital?" "We're expanding the patient advocacy program to other hospitals in the city. 3 medical schools have asked us to develop curriculum on addressing healthcare disparities, and the nursing program we started is graduating its first class next month." "And what's next for you?" Angela smiled. "I'm exactly where I want to be, doing work that matters, raising my boys, and proving that one person can make a difference if they're willing to try." As the Carter family prepared to leave that evening, Liam ran back to Ethan with something in his hands. "Mr. Ethan, I want you to have this." It was the wooden toy car, the same one Ethan had bought for $500 a year earlier. "Liam, that's yours. I gave it to your mom, remember?" Mom said we should give it back to you. She said it reminds you that small things can make big changes. Ethan took the car, holding it carefully in his hands. It was just a piece of wood, carved with love and painted in bright colors. But it represented something much larger: the power of compassion, the importance of justice, and the possibility of change. Thank you, Liam. I'll treasure it. As he watched the Carters walk to the elevator, Ethan reflected on how much his life had changed. A year ago, he'd been focused entirely on building his business empire, measuring success only in dollars and market share. Now, he measured it in patient satisfaction scores, reduced treatment disparities, and the knowledge that his actions had made life better for thousands of people. He walked to his office and placed the toy car on his desk right next to his computer. It would stay there, a daily reminder that the most important decisions in life often happen in the smallest moments, and that true success isn't about what you achieve for yourself, but what you're willing to do for others. Outside his window, the lights of New York City twinkled like stars. Somewhere in that vast metropolis, patients were receiving better care because of changes that began with 2 boys and a toy car in Central Park. Somewhere, medical students were learning about equity and justice in healthcare. Somewhere, a mother was tucking her children into bed without worrying about how she'd pay for her medicine. Ethan smiled and turned off the lights. Tomorrow there would be more work to do, more problems to solve, more opportunities to make a difference. But tonight, he was content with the knowledge that sometimes, just sometimes, one person really could change the world. And it all started with the simple decision to stop and listen to 2 children who needed help. And that's the end of the story. If you enjoyed it, please hit the like button and subscribe to our channel. Your support and small effort motivated us to create the next video. Feel free to share your thoughts in the comment section. We'll definitely read and reply to your comments. See you soon in the next video. Until then, take care of yourself and your family. Bye-bye.